They come to us every day, Maryvale's children, their families facing a crisis, vulnerable and scared, their futures unsure and uncertain. Here, they find a nurturing place where hope is reborn, where they can be safe, where we help them heal, both physically and psychologically, where we empower them to take effective control of their lives. We're Catalina Health Center, and this is our story. Founded in 1935, JFCS is one of the oldest community-based agencies in the Phoenix area. A group of women involved with the local chapter of the National Council of Jewish Women came together to provide services to people who were in desperate need of jobs, food, and housing. During the next several decades, JFCS grew into a social service and behavioral health agency that provided emerging services for everyone. JFCS touches over 37,000 lives a year, and the Maryvale location is a very high-needs area. It has the highest rate of children removed from the home by the Department of Child Safety due to serious abuse and neglect. Service in Maryvale started in 1997 in one room with a staff of 6 who served 30 to 40 clients. Today, it has grown to slightly more than 100 staff, and over 6,000 people come through the doors.
One time we had so many people in our waiting room that the line came out of the door and was into the parking lot. And we knew that we were going to have to make some serious changes and find a new building and provide services to those people.
Maryvale is the poorest community in all of Maricopa County. JFCS is one of the largest providers of children's behavioral health services in the county. 63% of those treated at Catalina are youth and children.
And it's not just children, because we have children and families. A mother shows up with 3 kids. Let's say they're 3, 5, and 7. So we have programs that specifically are targeted towards children 0 to 5.
Keep going. Anytime a child is removed into state custody under the age of 5, it goes to this very special court and they order very specific assessments. Then Child Protective Services will request agencies such as ourselves to conduct those evaluations.
We'll have kids that come into care because of domestic violence in the home, the parents being drug addicted, abuse and neglect. That could be physical and or sexual and or verbal.
That's probably one of the more severe types of abuse. You can't always see the neglect, but the repercussions of the neglect we can see, and we'll see that years and years down the road.
The younger that you are able to get on top of things, to intervene, the better that window of opportunity for the child to grow and to be healthier. Because those first 5 years of life, they're building that foundation for the bonding and attachment, and can they trust the world and can they trust themselves?
When we can give those families hope, the typical message that we always get is, finally, I didn't know what I was doing before, and now something can be done to help them out. If I can pass on my knowledge, if I can pass on my caring, my feeling to somebody else that didn't know it, didn't realize that that was possible, that's what's important.
One of the great things about my job is to hear success stories. Somebody whose life we touched and they're better for it, and their life and their future trajectory is better.
This park was actually where I got jumped in the gang. I felt hopeless and really didn't care about my life, so I would, use drugs. I would gangbang and fight a lot.
Dimitri is very talented and very bright and has a lot of potential, and is a perfect example of what happens when you're raised in the foster care system and you turn 18 and there isn't anybody there.
The research shows that kids that have been successful have at least one adult in their life that has been consistent and has seen them through those hard times. So we've made a commitment, a Jewish family, to find that one person.
When I first met him, he was in a group home. He was looking at transitioning out. He really didn't have anywhere to go. When he left the group home, he went back into the drugs. And some of the gang affiliations and involvement. I wanted him to go to a treatment center for substance abuse. He wasn't very for it at first. He wasn't excited about it, I should say, but he said he would try it, and he did it. And from there, he went to a halfway house. From there, he did the training, got the job, and I just happened to be that person that was able to tell him, hey, look, man, that's not what you should be doing.
He knows where I'm coming from, and he has been there all the way.
We don't quit on our kids. We are not going to get rid of them for the very reason that they're here. We're going to keep working and keep finding a way to reach them, and what is that hurt, and what can we do to make it better?
I'm really not alone. I'm really not.
For people like Dimitri, Catalina Health Center was a tremendous asset in his life.
JFCS is dependent on private support to help pay for the things that government doesn't pay for.
Without philanthropy and without help from the community, JFCS would not be able to provide services to some of the very poor people in that area.
The Catalina Health Center will be an integrated healthcare facility, treating the person's whole health. It will house not only therapists, but primary care physicians as well. It is a known fact that people with mental health issues tend to develop other diseases such as diabetes, hypertension, and congestive heart failure.
I've been asked how we're doing this. Why do you need community help? We were so overcrowded and the demand was so high that after we looked to find a building, we just had to make a decision to change because we were actually in crisis mode. So JFCS went out on a limb that we would be able to get enough community support to do this project and to do it well.
The new Catalina Health Center will provide advanced programs and services for this underserved population and a welcoming and safe environment for clients walking in the front door.
So we made the investment, we were taking the risk, and we really need the community to help us put this together. Because of the limitations on government funding, Catalina Health Center cannot continue to provide high-quality services, staff, and programs without philanthropy.
The problems facing Jewish family and children's service have been documented. The solutions have been identified. The outcome of the effort to achieve those solutions will determine whether JFCS can effectively respond to the increasing demands for the highest quality healthcare in the Phoenix community of Maryvale. But there is something else at stake. Can Jewish Family and Children's Service continue to live up to the praise of a client named Dimitri?
If it wasn't for the services I would receive from JFCS, I think I wouldn't be here and I would have stayed where I was at, drugs and the streets.